the part that tends to get people down, which is the critical analysis. Yeah. Okay, so as Vi said just now, I think often when you come up to present to us, this is how you feel, right? You're this person on one end of the road, and we are all there with our weapons and our brickbats all ready to kind of hit you on the way. And this is really not the intent. Yeah, and it may feel that way, but this really is not the intent. And what we feel often is this. We try not to show it, but this is how sometimes we feel. Yeah. So how do we get out of this? I think it'll be these are just some of the things that we'll cover today, so that you can have a really, really good experience. So we all have a really good experience when you come up and defend your thesis. Okay. So what I'll cover today is number one are the common errors that can be observed. Number two is the principles of critical appraisal, because essentially this is what we want you to present when you're defending your own thesis, that you have been able to critically appraise your own product, right? So that you know what the strengths and limitations are. And then finally, a few tips to have a really good presentation. Okay, so what are the common errors? I'll go first with what I call the technical errors. Yeah, number one, a poor understanding of the clinical problem being investigated. Okay, and what does this mean? It means that, for example, if you are doing something on, say, colorectal cancer, right? Yeah, and you're doing something maybe on the colonoscopic diagnosis or something new in colonoscopy, say, let's say, right, on diagnosing colorectal cancer or staging colorectal cancer. But when we ask you questions, you aren't able to explain the clinical problem, right? So so it sometimes seems like maybe you have a very superficial knowledge about what you're trying to do. You have a superficial knowledge of the limitations of previous diagnostic elements. So you can't argue why you want to study this topic in the first place, right? Especially if it's something that may be similar to other things done before. You're not able to argue why someone would want to spend 2.5 years studying this topic again. Okay, so try, at very least, you must understand this particular thing that you are studying for your thesis very, very well. Okay, the next thing is actually ignorance about your own study, right? So the first thing is about the clinical problem. So let's say if you are doing something on gallstone disease, number one is knowing about gallstone disease, but then secondly is about the design of your study itself. Okay, for example, when I say clinical setting, how feasible your study is, how you design your study is based very much on your clinical setting, right? So if your setting is an urban academic center like UM, versus maybe someone with somewhere with which can be quite not quite rural, but it can be the center for a large rural population, say like in Kuching or in Kota Kinabalu, right, where many of the patients may have to travel very far, right? You have to understand your clinical setting to understand whether it's something that makes sense within the design of the study, right? We also frequently find that you're often not quite sure about what your actual research question is or your study objective is. Yeah. Then the design, of course, if you're using a kind of using a tool, right? If you're using, say, you're testing imaging or you're looking at a certain therapeutic innovation, or if you're looking at a questionnaire or measurement, you must also be able to argue why you chose it, what its limitations are, right? And something simple like where has it been used here before in Malaysia, right? And if it's not been used in Malaysia before, is it usable in Malaysia? And then you have done your research to check, is it usable in Malaysia? So for instance, something very simple, like if it's a questionnaire, right? So questionnaires or quality of life tools or surveys are very dependent on the population on which it has been tested, right? So if you are the first one testing this population, you need to be able to argue, why do you think this questionnaire or tool can be imported from another population? Okay. And then of course, statistics. Statistics, I know it makes people sweat, right? Because you're so afraid they're going to ask you about some tests that you did, or some correlation, or some Kaplan-Meier curve or whatever, right? I think personally that for those of us who are assessing your final defense, I think we are quite reasonable in the sense that we don't expect you to know what, to have the knowledge about statistics equivalent to a statistician. But we do expect you to know the statistics for your study. Okay, So we don't need you to explain the statistical analysis or the statistical principles for everyone else's study, right? So usually we don't, right? But what we do expect you to know is really thoroughly about why your statistics were chosen and why you did what you did, right? And that plays also into the sample size and power calculation, which you would have defended before your final, which you would have approved before your final defense. Then next would be ignorance about terms used in your presentation. Oh, this is a very super common one. Yeah. So, for example, if you say a very common case control study, this is a case control study of a population, blah, blah, blah. And then we ask you, what does case control mean? And then silence, because you're not quite sure what case control means. Yeah. So if you're going to be using it in your study, know the term that you're using. Okay, this is a very common, and we see it across all stages, at the start of the proposal, in the middle when we're doing your evaluation, progress evaluation, and at the end of your defense as well. Then not incorporating advice from previous evaluators. Now, listen carefully to the comments that we make during each of the evaluations, because you will find that the same gaps and weaknesses that someone has pointed out before will arise again if they're not dealt with. Okay, so, and you don't want to be going back and forth on the same point again and again when someone experienced before that has already brought it up as an issue, right? So each of these critiques, listen to them. If you don't understand, that's what you need to be bringing back to your supervisor, saying, I don't understand that. I don't understand what they were saying. Can you help me with this? Okay. And if you both don't understand, because that sometimes happens, sometimes it's a matter of being the middleman. You don't understand the concept, and you might have passed a different message to your supervisor, in which case then you might both want to get back to someone who knew what the critique was about, right? So sometimes it's not that the critique was made that was unreasonable, but more in the sense that maybe you are not passing on the information properly to your supervisor because you also don't understand it. Okay, which is fair enough, right? So in which case, if you don't understand it, bring it back to your supervisor, and then to someone who does know what the issue was about, right? Then we have also common errors in presentation. Treating the screen like a teleprompter. Okay, what does that mean? So not point form like this. Sometimes we get I hope you can see my mouse. Sometimes we get a whole page full of words, and then we can, people are reading up and down, up and down, and up and down, and then we don't know what essential information is. All we know is that there's a mass of words, or a table with huge numbers, right? And then you're kind of reading through, right? So don't treat the screen like a teleprompter. Use it as a guide to cue you in, because you should be knowing your pieces very well, at the back of your hand. So just use the PowerPoint slides to highlight what is important and to guide you in your presentation. Okay. Mixing up methods with results. This is again very common. Okay, methods describe what you did. Results describe what you found. Okay, so a method would be, this is a prospective cohort study of all patients admitted with all patients admitted with stage 2 breast cancer between okay. Your result is there were 212 women admitted for stage 2 breast cancer, right? But often what we see is, in your methods, you will say something like, we reviewed 212 women who were admitted, but you don't know you have 212 women admitted until you have done the study. Okay, so your methods must always be what was done for the study. It's the results that describe what was done after, what you found from the study. Okay, so be very careful, but this is also a very common mistake. And a common mistake also in your manuscript, for those of you who are able to bring your thesis forward to the manuscript publication process. Okay, not following the template provided. I think I mentioned that just now. Okay, we have but unfortunately we do see it time and time again, right? So we have a template for you, not because we are very protocolized, or maybe well, protocols help us, right? Especially for those of us who are not very experienced in this. Protocols help you. So the template is there to help you to make sure that you haven't missed out any information. This is a big bugbear of mine: bad grammar and spelling. Okay, and those of you in P3, you know this is my bugbear, right? Okay, Why? Because how you say something, right? Poor grammar, it isn't just a matter of a throwback to your primary school, your secondary school teacher. It changes the meaning of what you're going to say. And in scientific papers, meaning is very, very important. Yeah, we're not writing a book of fiction where it doesn't really matter whether it's red or amber or ochre or crimson, right? I mean, it matters, but those words evoke feeling, right? But for us, if we say something is a prospective study, it means prospective study, right? So when you change the grammar, or when the grammar is not correct, you change the meaning of what you're trying to present. And spelling as well, because some words can mean something completely different when they're spelled differently, although the spellings may look similar. And that again changes your meaning and your conclusions, okay? And nowadays it's so easy. You can just put your sentences on Google and a Google Doc, and it will automatically suggest corrections for you. And even medical corrections. So I've done this a few times, right? Correcting papers, writing papers, vetting questions, whatever. It's not bad. So Google actually has a pretty high, pretty large amount of medical jargon. So they're able to correct even the medical language. Yeah. So give it a try. I'm not even asking you to buy a proofreading software. You can actually just use Google, which is already not too bad already. Yeah, and including the spelling as well. So that's common errors in presentation. Then I'm going to move forward to the next thing, which is principles of critical appraisal. Right? We use these principles when we discuss journals, when we analyze journals, and when we critique journals. And if you use these same principles on your own thesis defense, right? So you have been working on your thesis for say 2.5 years. Stand back away from the thesis that you've been working on so hard. Use and apply the principles of critical appraisal on your own work. And then you will find that then you will start to see what it is that we keep asking you questions on when you're defending your thesis in front of us. Okay, so these are the main basic principles. Of course, you can go a lot more into depth, but I think these are the important ones, which is number one, validity. Can we believe what you're saying? Can we believe the study that you've done? The importance, if we believe it, does it matter? And applicability, if it matters, does it apply to our patients? So basically, in your case, if you've already done the study on our patients or your patients, can this then be applied to other patients in different situations? Yeah? So validity is examination of the methodology, and it describes the quality of the research. Basically, it is how well you have designed your study to answer your research question. Okay. So validity goes hand in hand with reliability. So validity is the extent to which the results really measure what they're supposed to measure. Okay. And usually, yeah, not all the time, but usually what is valid is usually reliable. Okay, so I'll say that again. Validity, the extent to which the results really measure what they're supposed to measure. Okay. Reliability refers to how much they can be reproduced. Okay. So if someone else wants to repeat your study, okay, and they have a very similar environment, similar patient group, let's say a similar target population, and they use the same methodology, they get similar results, and it keeps happening that they are always able to get similar results. That's called a reliable study. Okay, reliable results. Now, a reliable measurement is not always valid. Okay, because you may be having a systematic error that always reads and gives you a really nice result, but it's wrong. Okay, yeah. But these two concepts go hand in hand. What is valid is usually reliable. Okay, reliability also actually informs your power calculation. Yeah, I'm not sure how much you understand about what's a power calculation. I think there's a biostatistics course as well for master students. But an 80% power calculation means that if you repeat the same study 80% of the time, you will get the same result. For power calculation of 90%, 90% of the time when you repeat the study, you will get the same results. Okay, so that's all that, which is why we harp so much on a power calculation. So next, these are various types of validity. Okay, to be complete, I've put the labels on the right. So for instance, in this case, construct validity, you honestly do not need to remember it. what you need to remember is why we talk so much about validity. Okay, so does the test measure the concept that it is intended to measure? Okay, so for example, right, one of the studies that I'm doing is on bowel function in some kids with congenital GI abnormalities. Okay, if I want to measure bowel function, there's a number of things I can use, right? I can use a quality of life measure, I can use anorectal manometry, I can use a bowel function score, right? So you have to match the test to what it is you're trying to measure. Okay, so if I choose, let's say I'm going to measure bowel function by using anorectal manometry. Someone who is asking me about constructability will say then, well, does an anorectal manometry measurement really tell you how well the bowel is functioning? And that's a very fair question. And you will find that we will ask those questions as well when you defend your thesis. If you're going to choose that to measure bowel function, in my case, in my project, is that really measuring bowel function? Or are you just measuring that one measurement in that point of time when you do your anorectal manometry? Okay. Next, content validity. Is the test fully representative of what it aims to measure? Okay. Content validity, is the test fully representative of what it aims to measure? Once again, this is not an exam, so you don't have to memorize what content validity is, construct validity, etc. It's more to stimulate your brain to ask the questions that we would be asking you in your defense, right? So back to the study that I'm doing. If I'm doing a study on bowel function in children with congenital GI abnormalities, I can measure for constipation, I can measure for incontinence, right? I can measure for wearing diapers. Are they still wearing diapers in school? What am I measuring? And is the test measuring what I want to measure, right? So in my case, if I want to measure bowel function, actually it's all of the above, right? So I have to choose a test that measures all the things that I want it to measure, right? Next is face validity. Does the content of the test appear to be suitable to its aims? Okay. What does this mean? One very good example, which I remember from a course I attended some years back, is there's a popular activities of daily living questionnaire that people often apply to patients with rheumatoid arthritis. Okay, and one of the questions is turning on a tap. Can you turn on the tap in the morning? Okay, and that's supposed to test about your fine motor skills for a patient with rheumatoid arthritis to see how symptomatic they are in the early morning when they have the most stiffness, right? Now, what does it assume? It assumes that you have the twist tap, right? It assumes that you have to twist the tap in order to turn on the tap. But if you think about it, there are many, many different types of taps nowadays, right? You can have a tap where you just flip it up. There's no need to twist the tap. And just when you can change the form of the tap, you've already reduced the validity of the questionnaire because you're already not testing for what it was supposed to test in the first place. If you, even more so, if you have a tap that is a motion sensor, right? So you got a sensor, all you have to do is wave your hand in front of the tap to turn it on, to turn the water on. Even more so, it requires less fine motor skill, and even less does it test for stiffness of the joints in a patient with rheumatoid arthritis, right? So even when you choose something like that, you have to go down, drill down into the details of what you're trying to do to see whether it really measures what you're trying to measure. Okay. And then finally, criterion validity, which is do the results correspond to a different test of the same thing, right? So if you're going to be measuring, once again, if I'm going back to bowel function, does one bowel function score correlate with another bowel function score? And this is something you don't necessarily have to talk about in your method section, but it comes across really well in your defense and in your discussion, in your thesis discussion, if you can talk about all these things, because it tells us that you have really thought about each item or each aspect of the study. Okay. Next is importance. If we believe it, does it matter? So what is importance? I put this picture here, okay, to show you this concept. Is the study clinically important? Is your study clinically important? And this is an examination of the results, okay? And I put this picture here because this is the G7 meeting, G7 summit that took place, I think, about a month ago, right? And you've got world leaders there, right? You've got Europe, Canada, North America, Bojo there, right? But who is the most important person here? Straight away, you know it is Queen Elizabeth there sitting in the middle who is the most important person. And that's what you need to do to guide us when you do your thesis defense on what is most important. Don't make us have to figure it out, because we are not content experts, right? So if I, as a ped surgeon, am sitting down looking at thesis defense on something from, say, from adult urology or from plastic surgery, I'm not a content expert. So, and most of us will not be, because your panel will be made up of many different people, right? And it won't be your supervisor, right? So it is up to you to be able to help us understand immediately with your presentation in that 7 to 12 minutes or whatever they've got, what is important. Your eye, what you show us has to guide our eye directly. So some of the things that you should cover, depending on the type of study that you have, right? So yours may be a study on therapy. It may be a diagnostic study, okay? Or it may be a study of, a study on prognosis. Okay, so these are the various things that you need to mention to tell us how important this study is, what is clinically important about this study in your results section. Okay, so for instance, in a therapeutic study, you need to mention the clinical relevance of the outcome, what the effects are, and what the precision is. Okay, if it's a diagnostic study, you need to tell us about the performance of the study, which is back down already. If you read, basically it's doing a good journal critical appraisal, right? That means when it's diagnostic, you tell us about sensitivity, specificity, right? The negative, positive, predictive values, likelihood ratio, right? Whereas if it's on prognostication, right? So for instance, how does a patient do after they've had this type of chemotherapy or chemo radio surgical combination, right? You need to tell us what the clinical relevance of the outcome is. And again, right, the precision and the comprehensiveness of the information. Okay, so these are the kind of things you need to tell us in order for us to be able to understand how clinically important your study is. Finally, it is applicability. If it matters, does it apply to our patients? Yeah. Are these valid, important results applicable to my patient or population? Now, when we are the panel sitting on the defense, obviously you have already done your study on your population, right? But we are trying to assess then how generalizable it is. Can this be carried out to more environments, to more patients, or was it this one short point in time where it was only relevant for your patients? Yeah, and obviously we want you to having spent 2.5 years on your thesis, it should be something that's easily applicable across a wide population. How do you assess applicability? This is very, very important, and a lot of people also don't understand it. You have to evaluate the study's patients in comparison with the patients to whom the evidence would be applied. Okay, so the reason I use this illustration, okay, so classic Snow White and the Prince. Prince is trying to give Prince is actually trying to save her, right? But in the age of Me Too, in the age nowadays when everyone's very sensitive, right, about how you come across to someone of the opposite gender, you got two policemen who completely one policeman, one policewoman, completely misread the situation. Okay, which is why how applicable your study is really relies a lot on the culture of the population, the socioeconomic status, right, healthcare access, religion, right? So for example, a very easy one is something that is easily done in the West. So let's say a full psychosexual history, let's say, right, in some patients who are on permanent stoma, right? May be very easy to deploy in a society or a culture where it is a lot easier to talk about it, versus in our society where it might not be, and in which you may have to then tweak or change how the study is done, right, or how the questionnaire is deployed, so that it can be something that's applicable to our population. Yeah. So for instance, it may be that you may have to define the situation in which this kind of psychosexual questionnaire may be deployed, right? So you have to understand its applicability within the context of the population itself, right? And it requires an understanding of the local culture and health expectations. So in summary, what we need you to tell us is why we should believe your study, which is when you defend your methodology, why your study is important, which is what is new in your study and what is the impact of your study, and why we should use your study findings in our patients. Basically, the usefulness of your study to others. Okay, so tips. Know your study inside out. Okay, we often find that you don't, and then you kind of have to flip through. And then sometimes what happens is that you present something to us, we ask you something about your study, you can't answer the question, and then we find that, hey, hang on, in your printed copy, you have actually written it out. Okay, which means that you're not familiar enough. You cut and paste enough for the printout copy, but you didn't actually read what you cut and paste out. Yeah, so know your study inside out. Use a critical appraisal tool or a checklist. Okay, there are many critical appraisal tools, right? Use an appropriate one for your study. If you can answer all the questions that's in that tool on your defense, we will have nothing left to answer. We will have nothing left to ask you on your defense. Avoid obesity. What does that mean? Padding up with irrelevant information. Okay. We don't need a deluge of information. We need the salient points. And importantly, we need you to have like a picture I showed you just now of G7 summit with Queen Elizabeth in the center. That's what we need. All right. Everything else is unnecessary. Just leave the information that is important to putting your message across. Grammar check, as usual, my bugbear. Do a grammar check, please. Okay. And get a second opinion, right? So you may be often you have been so close to the study that you've been doing for so many years that you may assume that that something means what you say when actually someone new listening to it may not have the same understanding, right? So just grab one of your colleagues, one of your friends, say, present in front of them, say, how does it sound to you? Does it make sense what I'm saying? This thing that I'm presenting to you, or the words that I'm using, does it make sense to you, right? Get a second opinion so that at least you remove the fatty bits, right? And you leave what is important. I think that's about it. That's all I have to say. We can take questions now or maybe later.